Today, we're going to talk about social justice and how it applies in healthcare. In healthcare, you want to ensure that there is fair distribution of resources and upholding of human dignity, and you want everybody to participate and included in the service delivery. So, if there is a care needed or something, you are giving it to everybody who is in need irrespective of their race, religion, financial abilities, and all that. So we will talk about like some of the principles which guide. One of the main principle is equity and fair distribution. Means like care is delivered based on need, ensuring that underserved population receive adequate attention. So think about a community health clinic which is offering free diabetes screening in a low income neighborhoods so that everybody who needs that diabetic care receives it. And then when you think about human dignity and rights, I'm sorry, human dignity and rights, every patient deserve to be treated with respect and should have access to healthcare services without discrimination. So ensuring non-discriminatory policies in hospitals so that patients, regardless of race, gender, and income level, receive the quality of care. Now, when you think about participation and inclusion, you want to encourage marginalized communities also to have voice in healthcare policies. Example, you want to involve like Native American population or other minority communities in the hospital boards to better understand their healthcare needs. Now, when your accessibility, service accessibility, when you think about that, you think that you bridge between social justice principle and real world impact, like a mobile clinic that travels to remote areas offering vaccinations and basic medical services to individuals who lack transportation. That is like service accessibility. Like if they can travel, you go there, kind of thing. So when you're implementing these social justice principles, you are doing it at an individual level or a community level, or you're doing at a policy at a Congress level to pass bills which would impact. But let's think about like nurse practitioners. They add so much value in expanding services. Now, they can't practice in many states by themselves, but there are laws being considered where they can practice without supervision um, in and not requiring a physician. So those are at a macro level happening. At a micro level, when let's say that a small clinic is making some changes, so let's say that they put Friday free clinic for a few hours for people who don't have access. So that's at a micro level. So at a micro level, when you think you have pro bono care, let's say that you have a clinic and you Friday you open up 2 hours for free service, that is free clinic. Mission clinic means like medical professionals volunteering at free clinics that provide essential services in underserved areas. And then community outreach is your hosting mental health workshops in schools to educate students about coping mechanism and available resources. Now, at a macro level, what we talked about in a Congress, healthcare law reforms and like rights for everybody, like in universal healthcare means like in Canada and Australia, everybody gets the same care. So there is some thought of like moving towards that. So policy advocacy means lobbying for Medicaid programs. So, for example, Medicaid expansion to cover low income populations and reduce healthcare disparities. So, the values in action is you're combining volunteer work, medical service programs, and legislative advocacy to ensure sustainable programs. So, for example, a nonprofit organization that not only provides free medical checkups, but also works with legislators to increase government funding for rural health facilities. So, they are not only delivering the service, but also working with government to increase the services for everybody. I hope that helps. Thank you.